Dr. Darsh, how
Hey,
you
what's
doing,
going
my
on,
man?
man?
How is everything?
Good. I'm enjoying, man. Can't
Awesome,
complain. So, how are you?
awesome. Very well, very well. Happy Saturday.
Yeah, happy Saturday, man. It's my day off. I'm definitely enjoying it. So,
Yep, absolutely. So we are on the clock, so we are going to get started. Again, I want to welcome everybody to the Art of Mindful Medicine. This is episode 17 with my very special guest today, Dr. Darshan Shah. And first of all, I want to thank you for taking the time of your day off and coming on here to spend some time with us and talk to us about the things that you do and how you view medicine and mindfulness in medicine and things like that. But also, I want to congratulate you because you were just recognized as one of the top 50 doctors to follow on Instagram. So
yeah,
that's
thank
pretty
you.
cool. I didn't even know they did stuff like that. So that's awesome.
Same here. Thanks, man. I appreciate it. Glad to be here talking to a great guy like you, man. So, I'm excited to delve into this. Yeah, talk about things. Hopefully,
Absolutely.
give the viewers some cool tips here. So, yeah.
Absolutely. All right. So, as always, I am the host, Dr. Seth Gilson. I am a biological dentist, certified yoga teacher, speaker, and personal coach. And like I said, my very awesome guest today is Dr. Darshan Shah. Dr. Shah is a first-year resident physician at Penn State Hershey Medical Center, completing his residency in physical medicine and rehabilitation, with the goal of practicing musculoskeletal regenerative medicine in conjunction with integrative and functional medicine. He is also a pre-med coach and focuses his social media and podcasts on mindset and lifestyle optimization. So, bunch of cool stuff to talk about. I love all of that. So, first of all, I always start with gratitude. So, Darsh, if you could please share 3 things that you're grateful for with us today.
Yeah. First thing I think I, 100% grateful for is being a physician finally, right? Like just being a resident. Although it could be like grueling hours, and a lot of times I just like don't want to go to the want to have that admission so I didn't go in, right? So that's the first thing I'm grateful for. Second thing I'm grateful for is
Mm-hmm.
to wake up, with my wife right next to me. She's been such a huge support for me throughout this residency process. When she was actually gone for a month and a half, I lost like 4 pounds. So definitely grateful for her to be there. And then
Wow.
third, grateful to be here right now, honestly, to be able to connect with people like you and the audience and kind of just have a great discussion about like what really matters in life, right? And this is, I think, what we're doing in our mission. So I think those, yeah, are definitely the 3 things.
Absolutely. I definitely share that with you. I mean, there's so many different aspects of life and there's so much going on in the world, as always, but especially right now. And I think it's really important for us to focus on the things that really, really matter in our life, on a personal level. And that's where we start. And then we kind of branch out from there.
Absolutely.
So I'd like everybody to get to know you a little bit. So if you could please share a little bit about your personal story, growing up, what was your life like? Where are you and your family from? Things like that.
Yeah, so fun fact about me, I tell people, is I was actually born in Auburn, Alabama. Now that's something most people don't like. When you look at me, you're like, wait, what? Like Auburn, Alabama. So huge Auburn Tigers fan for college football, Atlanta Braves fan. And the reason I bring up sports is I grew up as an athlete. Any sport you name, I'll play. I'm competitive. I'll do it. My main focuses in sports though were track and field and basketball early on. But my track coach was like so crazy that I would get home and I would just go straight to sleep. And my parents were not having that because they're like, you need to do your homework, you need to get straight A's. So
Mm-hmm.
it made me quit track, and now I had to choose another sport. That's why I chose tennis. So kind of fell in love with tennis, still play it.
Mm-hmm.
But a lot of my childhood was really focused
Oh, the audio cut out a little
on
bit.
that. So a lot of people
Uh-huh.
ask. So a lot of people ask me, how did you choose medicine and stuff? I just think growing up, I was always interested in the sciences. I was always interested in the why and being inquisitive and just kind of figuring out like, one, how does the world work, which I'm sure we'll kind of
Mm-hmm.
get into, but also just human anatomy and physiology. And so I kind of knew medicine throughout high school and everything. Ended up going to Temple University and being in their seven-year med program. So like 3 years undergrad, 4 years med school.
Mm-hmm.
Fortunately, did not make it through. I missed the GPA cutoff by 0.02, which happened to be the best thing that ever happened to me because it forced me to take a 2 year gap year before going to med school. It forced
Mm-hmm.
me to really hone in on self growth, personal development, really look at my weaknesses and strengths, and just kind of figure out who I am in those 2 years. Finally got into med school, went to Beacon, Virginia, which is like Virginia Tech's osteopathic school in Blacksburg.
Mm-hmm.
Um, so yeah, did my 4 years there. Finally came back up north. I grew outside Philadelphia, so now I'm in Hershey. So I'm only an hour and a half away from what I would call back home. So
Very
that's
cool.
kind of my story. Yeah.
Yeah, awesome, awesome. Thank you for that nice rundown. So I want to rewind a little bit and ask you something about your childhood because I think there's a lot of things that affect us early on in our life that kind of put us on a certain trajectory. Um, what would you say is your most vivid memory from childhood, which impacted who you are today?
Yeah. Wow. It's probably got to be something sports related. So there's two that really pop out to me. One was when I was playing, so I played baseball and I was a shortstop and I was a pretty good shortstop. I always won the Gold Glove like award for like the team or the league or whatever. And there's this ball that just got blind to me, just like to my right, and I just remember sticking my hand out, grabbing it, trying to tag out the person who was running, and then throwing it and like almost making this triple play. And I remember this one time I also stole home base or home plate, and like the other memory was basketball, where we're playing this travel team. We're down like two of our best players, and we kind of come back and win the game. And I score like
Hmm.
26 points or something. And the reason I bring those up is I really learned about self confidence in myself. I really learned what I was capable of and what my potential was. And growing up in a household where studies matters and grades matters and all these objective data mattered, it was very tough to kind of get out of that mindset to what we know now about you really don't have to go to college to be successful. You don't have to do these things to be successful. You don't need A's. You don't need all these things. You just need confidence and you need to understand your potential and you need to grow on that. So when I look back, I think those are the like things that shaped me were sports and being able to be a leader, being able to carry a team, being able to look back and say, hey, I was capable of those things. I can still do that now, even when I'm in my lowest moments. So that's kind of where I get my confidence from.
Beautiful. No, I mean that's fantastic. I mean, I can definitely relate to pretty much all that because I was completely sports related
Yeah.
growing up my entire life. I mean, I was planning on playing professional soccer in Switzerland. I played Division I soccer in New York. So I mean, athletics and competition was. I mean, that definitely set me on the track that I'm on for sure. I mean, and I've heard arguments that I mean for both sides about how whether competition is a good thing or a bad thing, and I think it's healthy competition that really makes a difference because it teaches us a lot about ourselves and discipline, and it teaches us how to work together as a unit, and I think that's extremely important in society. So
Absolutely. Yeah.
I think that's a great example, and I can definitely, like I said, I can absolutely relate to it. Um, so, and you touched on it a little bit, but when did that trajectory kind of change, and what inspired you to become a doctor?
Yeah. So what's funny is, so my brother Deep, he's a dentist.
Hmm.
He's 5 years ahead of me. So when I was in high school, he was actually in dental school, and I had a really cool dental experience actually, where I thought like, hey, maybe I want to do a dentist. My brother's one. Thoughts of like, hey, opening up a practice together. It's all very artsy stuff like that. And you're a dentist, so you know it.
Yeah.
Um, so I was actually pre-dental in that first semester. So I got accepted to a 7-year dental program. And then I
Oh wow.
switched over because I didn't want just a oral care focus, which now we know is not really the case when you can be like a holistic biological dentist.
Mm-hmm.
But not knowing that information back then, I kind of just loved human anatomy, human physiology, exercise physiology is what I was super interested in. And so I made that transition over to medicine. But I came across this quote by Robert too, and it says, "Don't be afraid to walk away from something that no longer grows you, serves you, or makes you happy." And when
Mm-hmm.
I look at medicine is something that'll always be growing. I mean, healthcare in general,
Yeah.
I'll always be serving, and it'll always be serving me. And then I'll always, I think, be happy in it as long as I can make the right decisions and have the right attitude. And I couldn't think of any other career where that could have been true for me. And so when I read that quote, I said, you know what, this is it. I kind of got to go and just put all my eggs in this basket and try to become a physician.
Hmm. Awesome. Awesome. That's amazing. And along this journey of changing your route and decisions and things like that, what would you say is the most significant challenge that you had to overcome? And what did it teach you?
Yeah, it was failure and rejection in college. So multiple things. So high school, I crushed, right? Like that's the reason I got into a 7-year med program. And the reason I bring that up is because even though you do super well in high school, I got 2140 SAT, top 2% of my class, whatever the grades. It doesn't matter in the end if you don't have a consistency and trajectory, to keep up with it. When I got to
Hmm.
college, missed that GPA cutoff by 0.02. Had an ex-girlfriend who just like cheated on me and stuff, so I had a really bad relationship. So like being rejected as a whole by society, by someone that you thought you loved, all these things kind of bring you down. And what I really had
Hmm.
to learn from that was perspective, self-growth, self-confidence, self-worth. Self-worth is really what like put me down this path of personal development and just becoming the best version of myself. Because if you don't believe in
100%.
yourself and you don't root in yourself, who else is going to root for you, right? And so, a
Yeah.
lot of people say Kanye West is a narcissist because he's a huge mural of himself in his house. And when you ask him why he has that, he's like, well, when you wake up in the morning, who's going to root for you? But so, like, you have to be the first person to root for yourself. And so
Yeah.
that's why he does that. And so, like, I just love that concept of you have to be your biggest cheerleader. And
Hmm.
that's really what I learned from those, kind of moments in my from 18 to like 22.
Fantastic. And I think, and you also said something before that grades and things like this don't matter, or don't matter as much as we once thought they did, anyways. And I agree with you because yes, learning and doing well in school. I think there's disciplines and things like that to be learned from those things. But I think getting a degree or doing it doesn't necessarily make you successful,
Right.
or more successful than somebody else. Um, I think it's really important that we focus on how to learn rather than just doing well in school.
Absolutely. And
So,
I heard this from Peter Thiel, the founder of PayPal, from reading his book Zero to One, and he kind of says there's a difference between education and learning.
mhm,
Education is just this concept of things you should that are knowledge based, right? And when we say
yeah,
education reform, he hates that. He's like, we
yeah,
need to reform learning. Learning is what we really need to instill in children and how to think and have a
yeah,
contrarian mindset, right? And go against the grain a little bit. So,
yeah. How to think is really something that I think we're in my opinion, that I think we're missing out on right now, as the overarching
mhm.
concept, because it's more along the lines of being told what to think. This is what you need to memorize. This is how things are done. And I think asking, not even necessarily that those things are wrong, but just to ask the questions, to be inquisitive about these things
Right.
is really, really important. So learning how to think is in my opinion, the most important part of learning. So,
Oh, yeah.
um, so now being a doctor and going through med school and these challenges that you've gone through, what's been personally the most impactful, from all you've learned in the health and wellness field?
Yeah, I think the most impactful thing that I'm kind of understand here is this shift. So history repeats itself, right? I think it's like a
Mm-hmm.
pendulum. And Ayurvedic medicine, Eastern medicine, that's all we really had before antibiotics and all this kind of stuff with X-rays and radiology and the concept of Western medicine.
Mm-hmm.
And then you have big pharma coming in, and the shift kind of goes back towards now Western medicine only. And what we're starting to see is the shift back towards Eastern medicine. And now we're seeing more naturopathic doctors, holistic medicine, functional medicine. And really just starting to learn that and have that contrarian mindset has taught me how much that type of medicine is needed in today's world. So, I've been able to shadow in it. I've been able to connect with other physicians who practice that type of medicine. And I'm like just fully convinced that we need to bring that back into today's world, especially here in the U.S., but even
Mm-hmm.
globally, making medicine more personalized, which it's starting to get there, but honestly making it more personalized, not just for the money, not for these big pharma companies, but to truly impact an individual so that they can live their best life and not the life of what we think the masses should live.
Mm-hmm. And you touched on something, that Ayurveda. And I'm going to get into more of the other disciplines and things that we talk about a little later, but I don't want to dismiss that because I've learned quite a little bit over the past year about Ayurveda, and I've had another guest on that who is an Ayurvedic practitioner.
Mm.
How do you see that being utilized in modern medicine, in Western modern medicine?
Yeah, so it's very tough right now because of the stronghold that insurance companies have, right? So the the downfall of the way it's run, healthcare is run here in the US is only the wealthy or only those who can afford will actually get this type of personalized medicine, functional medicine, because most of it's fee for service. The
Yeah.
insurance companies aren't going to cover this. So you
Mm-hmm.
have rural medicine, you have rural people, you have people who can't afford these things that honestly need it, but they can't. So they're subjected to just taking medicine and hoping that they comply to taking it every day. But we know that without proper education, without a great socioeconomic background, they're less likely to be compliant to this medication, which is gonna put them in this vicious loop. So yeah, I mean that's the toughest part is how do we get it to them? But I think we're gonna have more physicians who are gonna start understanding that hey, we need more functional medicine. let me get a certification in this, let me get a certification in Ayurveda, and let me try to at least put a little bit of what I can do in terms of patient education to get the ball rolling.
Mm-hmm. So in medical school, none of these things are really discussed or introduced, are they?
Oh my gosh. So the funniest thing is, as a pre-med coach, so many people ask me like, hey, what's the difference between a DO or an MD? Or I want to go to an osteopathic school because I want to learn holistic medicine in mind, body, and spirit. And I'm like, you're going to get zero of that. Like, osteopathic medicine says, oh, we're holistic and we're this. But in all honesty, you get one lecture about the philosophy from the 1800s, which does not
Yeah.
carry over to today's world. Yeah,
Yeah.
sure, you get to do OMM and that's more natural and stuff, which is great. But like, there's just all this marketing that's going on. And we get less than 24 hours of learning real diet and nutrition. So it's a complete, we're just learning Western medicine and how to treat symptoms in the end.
Mm-hmm.
So.
And that's exactly in alignment with what other doctors and different practitioners have told me, which is why I like highlighting and bringing that up, because everybody has a different experience, right? I mean, and certainly everybody goes to different medical schools and learns from different people. So I think as I'm continuing to do this, hearing more and more of the same thing from different people that do not know each other and have no association with one another, except that they are either a doctor or a practitioner in the medical field. It's really showing and highlighting where we're lacking in a lot of ways.
Right.
So I appreciate that. And then the nutrition aspect, I mean, I think you just touched on it briefly, but what would you say is the portion of nutrition that is discussed in your experience in medical school?
Yeah, so it's definitely less than like 24 hours. And what we really touch on with nutrition is more the biochemical aspects of it. What is the metabolism of fats? What is the metabolism of carbs? And then you'll barely touch on, oh, potatoes are high starch, or like this and this, or like FODMAP's diet for like IBS. But like that doesn't like, and we know diet is super personalized. Like what works for me is not going to work for you. And then we'll learn about the pathology of some stuff like celiacs and lactose intolerance. But we don't learn how to treat people with those things. What we learn is how to diagnose them.
Yeah, exactly.
So now it's on you to kind of figure out how you're going to treat it. So, yeah.
So, and then in like you said, I mean, in dental school, we take a lot of classes with the med students, and pharmacology is one of them, and that is heavy. I mean, we got a heavy dose of pharmacology, and that's where, like you're saying, you're not really taught how to treat them, but you're kind of taught how to prescribe for certain things.
Absolutely.
And I mean, I'm assuming you have a very similar experience.
Yeah, no, absolutely. So yeah, pharm is huge. It's a huge portion of your board exam, understanding the side effects, understanding the mechanism of action. I love pharm because I think it's so cool how you can take something externally and put it in and it changes your physiology. But is it the right answer? No, absolutely not. Like we need to stop giving medications and start supporting people naturally just through like food and diet. Which is a whole other conversation and like what the root issue is like here in the U.S. But
100%.
Yeah.
I think food, diet, and lifestyle are the kind of like the pillars, and then we use pharmacology because, like you said, pharmacology is really cool to learn about, and it's kind of fascinating how all these things are created and how it works in the body. But that shouldn't be the go-to for everything that we do in medicine, in my opinion, and from the other people that I've spoken to, like yourself.
Yeah.
So. And we are going to jump back into a few of those things in a few minutes, but I want to shift a little bit into mindfulness. And I know this is obviously a big thing in both of our lives, but if you could describe to everybody what mindfulness means to you.
Yeah, so to me, mindfulness is being aware of yourself in the situation, environment, and the life you're currently living. Mm-hmm. So it's a spectrum, right? So you have the past, present, future. So mindfulness could be putting yourself in the past, understanding the past, and then taking those moments and experiences in this time construct and bringing it to the present moment or bringing it to the future. But it's about being conscious and hyper aware of who you are and what maybe your purpose is. And it's a very tricky concept because when I think of it, I think of a lot of things. I think of, and I kind of mentioned this to you when we were talking over the phone about my previous Instagram, which is called Balcony Thought. And it's this balance between the present moment and the superficial and the now versus the cosmos and what can be out there and the subconscious and the things we don't know. And I think when you can explore all those realms, get comfortable with it, I think being comfortable is the key with mindfulness. A lot of people are afraid of death or are afraid of the past, right? So if you're living in the past, you're depressed. If you're living in the future, you're anxious.
Hmm.
And so you kind of want to be in that present moment. But learning to be okay with traveling to the future in your mind or going back to the past and just understanding that, hey, this is all kind of connected, and
Hmm.
figuring out that connection and your place in this world or in this realm or in this cosmos, to me would be mindfulness.
Absolutely, and I think that's very well said. And I think the more we learn to be present in the moment with ourselves, the more at ease we will find ourselves. And through exploring all these practices yourself, and what have you found to be some of the greatest health benefits from mindful practices?
Yeah, wow. So it takes a while. So that's the first thing. If somebody's starting out, it's not like, oh, you come out of a 5 minute meditation, you're like, what's going on? It takes months, honestly, years. But for me, I think like 6 weeks into a consistent meditation practice, I realized how aware I was of just situations, like just
Hmm.
weird things where even my roommates would be like, "How'd you notice that?" Like walk in and like you just notice something from the corner of your eye, like that's off or something like that. Or you
Hmm.
start to notice conversations or situations. You get to read body language better. So that's kind of just talking about like the things surrounding us in a superficial sense. You start to become more aware. And then what's really helped me as well is just a better perspective on life, a better outlook. I grew up with a stutter. I grew up with a lot of anxiety. I had a lot of fear of just the unknown. And now I'm super comfortable with the unknown. I'm super comfortable with having this perspective of death and remembering your death and being okay with, hey, I'm going to die one day. Like, let's make the most of this now. So it's really got me grounded, I would say, more than anything.
Hmm. Yeah, and I think, like you said, about being living in the past or living in the future, and how I mean it can make you anxious or depressed. And I think learning from our past is really where it's at. I mean, it's not because a lot of people try and suppress it or push it down or pretend it didn't exist and things like that. And you can't do that. I mean, I don't know anybody. I haven't spoken to anybody that knows anybody that's been able to do something like that.
Yeah.
So if you do, please let me know.
Right.
That would be fantastic. But I think either way, you'd still be better off learning the lessons and looking for the lessons. And it's not just one time. Oh, I thought about this and then I closed the door. I mean, you have to. I mean, as we go through life, there's ebbs and flows, right? So you take these lessons and you can apply them to different situations, and you might learn something completely different from a new situation based off of something that you learned from an old situation. So I think that's very, very important. And I will say I have read some research that I think even just doing a 5 to 15, or I think it was 15 to 20 minutes of meditation actually kind of changes the chemistry in your brain.
Mm-hmm.
And again, it might be very mild and it doesn't necessarily have any physical manifestations immediately, like you said, because it's a practice. And
Right.
one thing I've said on here, and several other people have said on here, it's like it takes years to become what you are. And
Right.
if you're ill with something, it's taken time to get to that point. It's not like you just slipped and broke a leg, and then even that, it takes time to heal. So the healing process takes at least as long, I would imagine, as the process to become that. So I think that's something that people really need to focus and realize is that there's no instant gratification with these things. I mean, it's literally changing the essence of who you are in some respect. And
Mm-hmm.
that's, it doesn't have to be an immediate change. I mean, it's something that is just slow, progressive. It's just one step at a time. And I mean, sometimes you take a step back, but overall, as long as you're progressing forward, that's really the goal here, in my view.
Absolutely. No, I completely agree. Completely agree.
Um, so how would you say that you incorporate mindfulness in your personal relationships and life?
Yeah. So what mindfulness really taught me is to calm down. So just like any other relationship, me and my wife will fight or argue about some things. But what it's really taught me is arguing or having those like emotions don't do anything, right? Like, and again, I talk about the bigger perspective of life. Like, if it doesn't matter in 5 years, don't waste your time for 5 minutes, right? So I kind of like just bring that into my relationship and like just I'm so much more okay with things that used to bother me, where I'm just like whatever. Like, why should I even cry over this or bother over this? Where I'm gonna be okay tomorrow, I'm gonna be okay in 5 years, and then once I'm dead, none of this matters, right? So it's like enjoy the moment, just enjoy what you have right now. So that's really what mindfulness has really brought me like a positive note with my relationships, and then it's also made me just be a better communicator, really follow up with people, have more empathy. And we'll probably talk about it more in the hospital as well. But really just having a human connection with people when you're more aware of the present moment and how that person might be feeling, putting yourself in their shoes.
So are there any particular practices that you utilize?
Yeah, so it's I do kind of a bunch of them. One thing I'll do is actually drive without any music, anything, like just in complete solitude.
I do that
Um,
too.
yeah, just and people are like, "You're crazy! Like, how do you not have anything?" And like, or like, and I tested myself once, and I drove from Philadelphia all the way to like Fayetteville, North Carolina, 7 hour drive, nothing. Just drove for 7 hours, and I was just like, I got to be comfortable with the uncomfortable. And it's so sad that in today's world, people can't sit alone with nothing to do for like 10 minutes. It's like, where's my
Hmm.
phone? Where's this? I need something. So just trying to practice being okay with silence and just uncomfortability. That's one thing I do. I'm no master meditator, but I do try to incorporate about 15 to 20 minutes a day. If I have time, which everyone should have time because they say if you don't have time for 20 minutes, you should do 2 hours. So I do try to like stack it as well with other habits. So that's something I try to practice. And then other thing, mindfulness, yeah, just grounding myself, being out in nature, going barefoot. Luckily, I
Hmm.
have the river and grass like right next to me, so really just enjoying nature and kind of just being with it, getting some sun. I think being connected with nature is huge for mindfulness and can really hone it in quicker into that Zen mode.
Yeah, and I've actually looked quite a bit into grounding lately, and there's some really profound studies on how healing grounding is.
Yeah,
I mean, just being connected to the earth. I mean, it doesn't even have to be for very long.
right.
I mean, we're talking again like meditating. If you meditate with your feet on the ground on the earth, you're essentially killing two birds with one stone right there.
Yeah,
I
right.
mean, so and look, I know we have crazy lives, and I know our schedules are a little bit crazy, but I mean, I think it's important for people to start incorporating things one at a time and just utilizing the tools that we can. And these things are free. And like you said, even if you meditate for 2 minutes, just sitting in that stillness. I mean, like you said, people have a lot of trouble. And I was like this as well, just sitting in stillness, not having something to do, not needing to go somewhere, not having to
Yeah,
talk to somebody, not having to hear something. I mean, I find myself like kind of going back to that too, which is really interesting. And then you just kind of you move away from it, and being in stillness has really been profound for me.
yeah, absolutely. In fact, like comment something here real quick too. There's a guy at Google. I'll just call him the happiness director or the mindfulness director, but he's got some sort of title like that. It's like one of the
Okay.
first 50 employees of Google, and he really just focuses on company culture and mindfulness. And what he tells everyone, all his employees, is just one deep breath a day, just one deep breath, and that's it. That's enough to change your chemistry. It's easy enough to be consistent with. But once you do that, once you really feel the benefits, you're going to start increasing that 2, 3, 4, really start delving into things. So for the audience out there, just one deep breath a day. Try that, and then
Yeah,
build from
definitely.
there.
I mean, we can all start with that. You're breathing already, so
Yeah, right.
I mean, you might as well do it intentionally. So,
Exactly. Yeah.
beautiful. And how about yoga? I think we talked a little bit about yoga too.
Yeah, so yoga was something that I was never comfortable with. Like I've been flexible, but I've never been one. I've always been like a meathead, gym junkie, all that stuff. I read this book called Grit by Angela Duckworth, and she has this one hard thing rule. You have to choose one thing that's hard and stick with it for a year. And what I chose was yoga and breath work. So actually, for the last like 3, 4 weeks now, I'm really delving into yoga either every other day or like 3 times a week, and just really trying to get better at flexibility, get better at doing something where I initially would have thought, I'm not into this.
Hmm.
But I'm loving it. Like I'm really seeing how useful it is, stabilization, being one with your breath, how to breathe, breath work, pranayama, like all these things are so important. And like you said, it's the foundation of kind of everything from where we stem as active human beings. So
Hmm.
that's like the one thing I've really been practicing. The other thing is called Sahaja Yoga, but it's more of a meditation, right? So yoga means like union. So it's more the
Hmm.
union of like breath and the balance between your left and right side. So the feminine, the male, the moon, the sun, and lining up the chakras. And so it's more of a chakra meditation. Yeah, so that's kind of how I really got into more of a practice. It's called Sahaja Yoga.
Okay, very cool. So, I mean, I know there's a lot of people that have never even heard the term mindfulness or mindful living and things like that. What kind of introduced you to it in the first place?
Yeah, so for me, I've always been interested in astrology, the cosmos, like we were talking about, like the unknown. And I was one to believe. So I grew up religious as a Jain. India is a very religious country, so my parents kind of instilled that into me and my brother. But I realized I was living more out of fear than I was happiness, because there's
Mm-hmm.
this whole concept of, oh, you can't do this, you can't do that. It's a pretty strict religion. And once I hit college, I was like, I'm just gonna let go of this and just do my own thing, and be a good person, and first and foremost kind of do that. And I realized how much happier I became, and so I continued with that ever since. And then as a physician, I'm so interested in the subconscious and sleep and how we manifest, right? Like the greatest ideas from Edison and all the Edison says, uh, whenever you go to sleep, never allow your, or like always give your mind a task, is what he says before you go to sleep, because there's so much power in your subconscious that we haven't yielded yet. So
Mm-hmm.
if I'm all about optimization and like living your fullest potential, it's got to come from your subconscious. That's what's got to manifest more and more into your consciousness. And
Mm-hmm.
so that's how I really got into meditation, is, hey, how can I harness this power of something that I don't even know?
Very cool.
I've always been fascinated with that kind of concept since a teenager. So that's kind of what got the ball rolling for me.
Awesome. So beyond the one deep breath, is there anything else that you would suggest for others to do as an introduction for them to start incorporating mindfulness in their life?
So I really love the app Headspace. So if you're a healthcare worker, you can actually get it for free right now. But I think his name's Andy Puticone. He's amazing in terms of explaining meditation. He's got videos with it. It's a very calming voice. I think that, or like if you don't want to pay for it, YouTube. I think binaural beats, if you're someone who likes to listen to music. I think it's really just being okay with sitting in and doing nothing, right?
Mm-hmm.
Naval Ravikant labels meditation as just doing nothing. And so it's whatever you kind of want to define it as and make it as, but then really just find your tool to really sharpen it.
Awesome. Awesome. I totally agree. I think, and again, this is something else I've talked about before, that people think of meditation or mindfulness as like your mind just is a blank canvas, and
Right.
there's just nothingness there. And I think maybe at some point, and other people, I mean, from what I understand, other people do reach that kind of state, but that's not really what meditation has to be. I mean, I think meditation is a healing modality for us, where just what comes in, and then just letting it go, just not sitting there and dwelling on these thoughts and things that come in, because you're not going to stop the brain. I mean, you're going to keep thinking. So
Right.
it's not about turning that off. It's more about surrendering and accepting what is.
Absolutely. And I mean, if you look at Tony Robbins, his meditation practice is actually more of an intention practice. So he
Mm-hmm.
primes his body in the morning. So his goal is not to just let thoughts come and go. He's actually thinking about things, but being super aware about it to the point where he can now harness his energy and physiological state so that he can attack the day. So there's also
Mm-hmm.
that realm that people can really tap into that really works.
Absolutely, yeah. There's many different types of meditation or practices like this. I mean, and it's about really finding what works for you,
Mm-hmm.
and I think probably incorporating multiple different types is a good idea.
Yeah.
So shifting back to the healthcare system, but in mindfulness, I mean, in your view, what is the state of mindfulness in the healthcare system, and what ways do you believe it can be enhanced?
Yeah, so mindfulness is atrocious in healthcare. It's terrible, right? Because it's one, we're all privy to burnout in the healthcare space. Why? You have 15 minutes with a patient. It's very low impact, actually, what you're doing as a physician. Patients will say thank you all the time, but that thank you sometimes I feel like doesn't carry a lot of weight, because you know you can do more, but time's restricted and you have so many patients to worry about, and there's a physician shortage. So now you're worried about more patients than you need to. And the other thing is, medicine, especially residency, medical school, it's a very selfish career in the beginning, right? When I go see a patient, I'm more interested in what do I know and what can I learn from you, rather than flipping the script and saying, what can I do for you?
Yeah,
And that's a hard thing to grapple with, because you need to
yeah,
learn in order to become a capable physician.
yeah.
But when you're in that state, you want to think, hey, I'm doing everything for the patient, but in reality, you're really not. So there's actually a book here that I have called Attending, by Ronald Epstein, and highly recommend this book to anyone in healthcare.
Mm-hmm.
It's not the most engaging book, but it's a very insightful book that talks about medicine, mindfulness, and humanity. And it really just talks about how we need to slow down, how we can avoid burnout, taking the extra time in a patient encounter, even if it's 2 to 5 minutes, how that
Yeah.
can free you so much time on the back end of things. And 2 nights ago, I had an admission at like 3 a.m. I'm exhausted. I'm on night shift right now. So I go see this patient. He's like an 80-year-old, and he's just talking in circles. And I'm just like, oh my God, like, can you please just give me the information? Like, I'm trying to go back to sleep. And it's very tough because, in the end, I was like, all right, I'm not really getting anything out of this guy. So when I called his son gave me like more information. I was like, all right, fantastic. I look back at it and I'm like, man, like, even if it took an extra 10, 20 minutes, it would have made the world of a difference maybe to him, but also to the treatment plan and to the day team and to the whole healthcare system in general in terms of how to take care of him. Because if he's
Yeah.
going in circles, what can I gain out? Like, what can I learn from that? If he's talking to me like that, how is he living at home? Who else is he talking
Yeah.
to like that, right? Like,
Yeah.
this affects everything. So you can't, for me at least, you can't look at it as just a one-on-one, me just trying to get information and treat you. But that's kind of what we're taught, and it's so hard to break that system. But if we can just be super present in the moment with that patient, we can really, really change the trajectory of that patient's life in the smallest ways possible.
100%. I couldn't agree with you more. I mean, this is in dentistry. Of course, it's a little different than the practice that you're speaking of. But I think taking that extra 5, maybe if you have 10 minutes to just sit and talk and just maybe get to know somebody. I mean, just to treat them like a human. I mean, and people respond to that, and like you said, that inevitably kind of reverberates out and changes the staff that's there, the people that you're working with. It can certainly potentially change that person's life. And I think that's really what the goal is, because, like you said, it's atrocious mindfulness in medicine right now. And of course, not everywhere, but because of course it is practiced in some aspect, in some areas, more significantly than others. Because like emergency medicine and things like that is obviously a little different.
Yeah.
But I think on an individual level, like you said earlier, living your best life and doing what you can to live your best life, and incorporating that not just outside of work or outside of being a physician or any kind of doctor or healthcare practitioner at all. I mean, utilizing that in medicine will change the industry or the field from within. So it's not like we have to wait for some kind of huge change to happen from up top. I mean, we as individuals need to really work on that and change that ourselves. So I think that was definitely very insightful.
Absolutely. And what scares me is, and I'm not trying to brag here, but I'm very good with patient interaction. I'm very good at being like mindfulness for the most part. And like many patients have said, like, Dr. Shaw, dude, you're the best physician like I've had that like at least talks to me and stuff. And if I'm feeling this way and I'm feeling like I'm not super present, well, what is everyone else kind of doing, right? Like, and that's what scares me as a whole. As physicians, we need to just be better and create this change. Because like you said, it comes from within. It's not something that's going to change from up top. It's going to get worse, if anything. So, yeah.
No, I agree. And I hope that people don't see that as a criticism, because I definitely don't. I mean, I think it as, again, you being the best you that you can be, and wanting to be even more. And I think that's really all any of us can do. And it's just having that awareness. If you don't talk about it and you don't and show your experiences and show your feelings and share that with others that are in similar positions that we are, they're not necessarily going to know any different. I mean, you have to learn something new somehow. And if you just surround yourself with people that only think and do the same things that you do, there's not a lot of growth in that. So I really want people to not take that as a criticism, but to, or at least as a constructive criticism, just to inspire you to do better. Because it's not just for the patient; it's literally for yourself and for your family. Because if you can instill these things in your life, outside of whether it's a hospital or clinic or office, whatever, it's going to be so much easier inside. Because obviously, for most of us, our biggest triggers are generally at home or in family or things like that. So I think that's very well said, and I like I said, I totally agree with you. Mm-hmm. So we got about 20 minutes left here, and I want to start talking a little bit more about what you do. So what kind of medicine are you practicing currently? Like you said, you at the hospital. What are you doing exactly?
Sure. So I matched into physical medicine and rehab. So to kind of explain what that is, because it's medicine's best kept secret, and nobody understands, like, what is PM&R? That's the number one question I get, even from my own residents, like even from my colleagues, like, what are you in? So it's not really, you don't get much exposure to it in medical school, but let me kind of break it down. So physical medicine, rehab. let's go to the rehab portion first. I think that's what most people understand. So when you watch TV, a lot of times we see these commercials of like a veteran with an amputation getting on the rails and like trying to walk again. So we're
Yeah.
essentially the doctors for those patients. So in the inpatient side, we're dealing with things like spinal cord injury, traumatic brain injuries, stroke, rehab, and essentially we're medically managing them as part of a team with occupational therapy, physical therapy, speech therapy, and our goal is to optimize their function so that when they get back home, they can get back to as close as possible to living the life that they were previously. So that's kind of the rehab portion. And then physical medicine is medicine that deals with the physicality of the human body. So more of the musculoskeletal and the nervous system. So things like that in the outpatient world would be things like sports medicine, interventional spine, so injections of back pain, pain medicine, nerve blocks. I'm really interested in doing like ultrasound and like orthobiologics, doing injections in different body parts to really get the body to heal itself. Other things like pediatric rehabilitation, cancer rehabilitation, movement disorders. There's so many different things like in PM&R that you can really specialize in. So I've been doing that for 4 years, but currently I'm in my intern year, which means I'm in my first year. And that's essentially just like an internal medicine year where I'm kind of just going through different rotations like GI, general wards, pulmonology, emergency medicine, things like that. So I'm just kind of getting exposure in my first year. And then after this year, I'll really delve into the PM&R aspects of things. And then
what a time to be going through all that stuff right now.
I'm sorry?
What a time to be going through all these different disciplines right now. I mean, that's just...
Yeah, it's definitely insane. Luckily, our program doesn't make us have direct contact with any COVID patients, so that's very nice. But we do treat them, we do admit them. So we're definitely like understanding how to treat these patients. But luckily, as residents, we're not forced to go and see these patients. But it's absolutely a crazy time. The hospital was running at like 60% capacity during like the height of the pandemic, and now they can overcompensate, and now they're running at like 103%. So now we're seeing more and more patients come in, but not enough beds, and it's such a mess, and as a whole. And there's definitely a second surge coming right now because we just admitted by like 6 or 7 COVID patients over the last like week. We probably had 6 over the last 4 weeks before that. So yeah, so stay aware and be careful, everyone. Yeah.
Yeah. And so in this part of your process or of the journey that you're taking right now, what would you say is the greatest takeaway?
Man, it's tough. There's a lot of takeaways right now because you kind of get thrown into it as a resident, and I know zero medicine. I still don't know anything. But the biggest thing I've learned is trusting the journey, trusting the process. Like, there are people in front of you who have done it and are great doctors now, and you're going to become one of them. You might not recognize it now, you might not feel it now, but imposter syndrome is real. And, I've definitely I'm 25% of the way through intern year. My confidence has kind of dipped, and I'm like, man, I still don't know anything. I'm 25% of the way there. But just trusting the system, trusting the process, trusting yourself. And I always tell people, if you don't feel imposter syndrome, then something's wrong. Because you should feel it. Because that's a normal part of the journey, right? Like, if you're not feeling it, then something's way off. But that's like the biggest takeaway I think I've taken from this whole journey is trusting the process, trusting yourself, being adaptable. So one of my good friends always told me there's 3 A's when it comes to medicine: ability, availability, and applicability. And ability is the one that people care about the least. So always make yourself available and always be applicable, towards patients, towards your colleagues, and that's going to get you pretty far.
Yeah, that's great advice. Definitely great advice. So, and I know something else that you look to get into in the future is integrative and functional medicine. Can you give a brief description? What are those?
Yeah, so integrative medicine is integrating different practices, kind of like how we talk about integrating mindfulness practices from different things. Integrative medicine would be integrating Eastern medicine and Western medicine, as well as like Ayurveda, surgery. So you're just taking everything and combining it and making it the best way for a patient. And then functional medicine is pretty much root cause analysis. So whereas in Western medicine, we do symptom management. Someone comes in with an asthma exacerbation. We're going to pretty much treat the asthma exacerbation, but they're going to go home and still have asthma. We never really dealt with, well, why does this person have asthma and how do we cure them of asthma? That's what functional medicine does. Functional medicine, sure, will treat the symptoms, but it's more about why did the symptoms happen in the first place. And so it's really looking from your birth, were you vaginal or C-section, all the way to where you are now. And like you said, disease happens over time. It doesn't just come on. So it's really
Hmm.
looking at what were the events that really triggered you to have the symptoms that you're having now. And that's what I love because, a lot of people say you can call it healthcare, but in reality, it's a sick care system.
Hmm.
We're not doing much healing. So I want to be someone in the forefront of healing and preventative medicine so that people don't have to go to the hospital and get treated.
Beautiful. Beautiful. Very, very good description. That's exactly my understanding of it as well. And I think that is a fantastic route to take it and something to aspire to. So I definitely commend you for those things. Um, so beyond the pandemic and things like that, what would you say is the most significant chronic ailment in our society today?
So I could definitely go with something like physical manifestation here, like obesity and stuff like that. But again, I think the chronic ailment, as you kind of described, is the ability to not think for people, like for themselves, right? I think we're acting too much of sheep. We follow the masses. We see social media. We look at CNN or whatever MSNBC, and we say, "Oh, this. Oh, the vaccine. This. Oh, Trump. This." We're so brainwashed by what other people are doing that we forgot to think for ourselves and what works
Hmm.
best for us. And that I think is also like a true pandemic in itself. Is that we've lost the ability to think, and because of that, you're seeing more obesity. You're seeing 90% of all like ailments are chronic conditions: heart failure,
Hmm.
diabetes, COPD. So it really just comes down to patients and people thinking for themselves. But how can we do that? I think it really comes down to the practitioner provider to really guide those people into saying, hey, like, you need to start thinking for yourself. You need to start looking out for yourself. Because if you can't take care of yourself, you can't take care of anyone else and make the impact that you're made to make.
That's exactly what I tell people. If you're not going to do it, nobody else is. And if you're so concerned with taking care of others, once you stop taking care of yourself, eventually you're going to reach the point where you just can't take care of others.
Right.
So, and of course, you're going to be doing that not to the best of your ability. Um,
Absolutely.
so the ability to think, and I think that's really important because, and like you said, it leads to so many other kinds of disorders and things like that because I think it just leads to a lack of accountability.
Yeah,
Um,
absolutely. And like as a pre-med coach, the one thing I tell all my students is, look, I can't help you unless you help yourself. Like this is completely useless if you're not willing to self-actualize and say, this is what I want to do.
yeah.
Because now you're leading down procrastination. Now you're leading down more towards failure and rejection, even just looking at an education standpoint. But like you said, it affects everything.
Yeah, so I mean, you can't help somebody that doesn't want to be helped.
Yeah.
But what are some of the things that you do? Because like you said, you work with pre-med students, and of course you're going to be doing this with patients. I mean, someone that wants it, but they don't know even where to begin. How do you approach somebody like that?
Yeah, so I have a coach here at Hershey, and he kind of said like I'm not a mentor, I'm a coach, and here's the difference. If you're trying to climb over a wall, a mentor will grab the ladder, it'll put the ladder for you, it'll teach you how to walk the ladder, but you just got to do it yourself. A coach
Hmm.
will teach you how to build the ladder, figure out what the best angle is, and it won't teach you how to build it, it won't teach you how to climb it. It'll just tell you kind of where these things are, and then you got to develop it yourself. And that's why I
Yeah.
like to see myself as a coach because I can help somebody out with an MCAT schedule or this or this or this. But there's more beauty in the struggle, and there's more beauty in long-term success if somebody can figure it out for themselves. And so it's kind of the same thing with patients. I can write on a prescription note, do 3 times exercise and this, or I can tell them the benefits, the risks, all these things. Kind of be more of a Socratic method is what I love to use. I love to question. So I have a lot of patients that want to leave the hospital, AMA, right? They just want to get out of there. And so I've always had this ability to keep them in the hospital because I start to question, okay, well, when you leave, what's going to happen? Well, when this happens, what's this? And you just keep going until they're like, oh, I guess I got to stay because that's the way that makes sense. So it really comes down
Yeah.
to questioning and for people to understand their why.
Yeah, the ability to think, like we were saying earlier, is so critically important. So I think that's definitely a great way to approach patients. And I don't know a whole lot of people in the hospital that do that, to be perfectly honest. So I mean, again, I think that's a great way to approach it. And with functional medicine, regenerative medicine, and integrative medicine, what do you think some of the biggest differences and some of the main benefits are versus the standard medical path?
Yeah, so biggest benefit is that it's going to be more personalized, more individualized. you're really looking at a patient's like their own objective data, their own data, right? So functional medicine is really key on getting the gut microbiome. So you're actually going to do a stool sample, send it to the lab, get all it's all evidence-based as well. Like you get a list of, this is the spectrum of bad bacteria versus good bacteria, and you have a lot of bad bacteria. So let's put you on a protocol. Let's do this in 3 months, and let's see the shift. And once you see the shift, you're going to notice how your lifestyle changes, more energy, your nutrition, you're actually absorbing the vitamins that you're taking. You're not making expensive poop. You're actually absorbing the things you need to. So I think that's the biggest benefit, like through all of this, is that sure, it's going to cost a little more, but when you can invest in your health early on, you're saving so much more in the end. And I think that's the hardest thing for patients to grasp, because we're in this culture of, oh, well, insurance doesn't cover this, insurance needs to cover that, you know, and sure, I get that. But at the same time, this is something that you're investing in yourself so that you can be your best self. And again, it comes down to what's your mission in your life for this impact that you're trying to make for the world, for your kids, for your family, for whoever it is. Really comes down to that. And then I think the whole the regenerative aspect, we're looking at ways to make the body heal itself. So things like platelet-rich plasma, where you're injecting, you know, a patient's own blood, the own growth factors are actually helping out and regenerating tissue in the body. So we're no longer giving things as symptom management like steroids, where, you know, it can actually do more harm than good, but it'll eventually like help. And I think the downsides of all these things is, one, it's only reserved for the people who can afford it. That's the sad part of it, but yeah.
PRGF and things like that is stuff we use in the office, and I mean, it is fantastic. It works so incredibly well. So we wrap up with just a couple more questions. How do you handle burnout?
Oh, that's a great question. So what I tell people, I get this question a lot, is it comes down to your end game, right? And what I tell people, what that means is, what's honestly your why in life? Like, what is the factor that's gonna keep you living and stuff, right? So I think for everyone, it has some sort of aspect with peacefulness, zen, living a happy life, and just being content. And so when I see all these pre-meds say, I need to get to med school, like, med school is not your end game. Your end game is not to go to med school, become a physician, and that's it. But using all these things in your life, medical school, meditation, these are all things that can help you with your end game and help you with peacefulness and happiness. So when you think of burnout, it comes down to the understanding of, I'm not going to even let myself get to the point where I feel like I'm burnt out, because it's not worth it. That's not my end game. My end game is not to be the best physician I can be. It's to be the best human that I can be and live the best life I can. And being a physician can help that. And I think having that perspective has really changed my mindset in terms of burnout and what it is. And sure, when you're in the present moment, there's times where I'm like, oh, I need to go home, I need to do these things. But I have the ability to be resilient, where I'm burnt out for a little bit, and I'll quickly get back into it, because it comes down to perspective. It comes down to understanding what are the important things in life. Being a physician is important, but it's not the only thing I do. You know, it doesn't define me.
Yeah, absolutely. I mean, we all get tired, and our energy gets low. I mean, it's like you said, how you kind of deal with these things. What is your philosophy or perspective on living an optimized life?
Yeah, so I think it comes down again to being the best version of yourself. You know, if anyone's ever read James Clear's Atomic Habits, he talks about becoming 1% better. And I've really just taken that and incorporated into my life. So when you become 1% better every day, which is absolutely nothing, that's like taking one deep breath a day, right? It's absolutely nothing. If you compound that over a year, you become 37 times better than yourself. Now imagine if you bought a stock and it went up 37 times in that 1 year. Oh, you'd be like, I'm wealthy. Well, now put that perspective into your own lifestyle. You're wealthy, you're healthier, you love better, you know, everything. So I think that's the main goal, is really just putting things in perspective and becoming 1% better. I think we live in a culture here, especially in the Western world, where we strive to do too much. We strive to make the most money once we have 30. We put labels on everything. Shark Tank makes us think that we need ideas, right? Like we live this world at such a fast pace that we need to slow down, and it's all about just becoming 1% better. And when you really look at those people who are successful, whether it's in wealth, in the health industry, or just spirituality, what we see consistently with every single one of them is that it takes time. Nobody made a quick million over a day, right? Or any of that kind of stuff. So
and if they did, they didn't keep it. So
right, yeah, exactly. So mindset, lifestyle, they go together. The gut-brain connection. So I think both need to be optimized in order for everyone to live their best life, and again, to make the impact that they need to make.
Awesome. 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 So we are going to wrap up, and to sum up this whole talk, because there was a lot of really good information that's very valuable for people. If you could only share 3 things that people should start implementing in their lives immediately to improve their health, what would they be?
Yeah, first, better sleep. I think sleep is the most essential component to mindset and lifestyle. There's a reason why we sleep, right? Like, it's not evolution. It's not survival. It's not advantageous for us for survival, right? We're sleeping, we're vulnerable. But yet there's still a reason why we sleep. So I think that in itself is super important. We don't have to eat, we don't have to drink, but sleep, we have to do. So sleep, for sure, I would incorporate. Number 2, I would incorporate some sort of reflection, some sort of practice, or either journaling, meditating, doing something to get into your own mind and becoming hyper aware of yourself. And the third thing I would say is lean into your fears. Whatever you're afraid of. Today's World Mental Health Day, actually. So I'm going to be making a post about this, about, my biggest fears and how I kind of leaned into them and how I kind of got rid of anxiety and got a better perspective on life. So don't be afraid to lean into your fears. You only live one life, and when you're dead, no one cares about your fears, and you're not either because you're dead.
Yeah.
So again, it's not meant to be morbid. It's meant to be realistic. Like, nobody cares. Just live your life to your fullest. So those are definitely 3 things I'll leave with you.
Awesome. I really, really appreciate that. Again, everybody, I really appreciate you guys coming on here and watching. This is a great talk with Dr. Darsh. And if you could just give us a quick recap of your Instagram and things that maybe something that you're working on that you want people to jump onto and follow and things like that.
Yeah, sure. So again, my Instagram's on here. It's Dr. Darsh, Dr. spelled out. You can reach out to me personally. I reach out to all my followers. So let's start a conversation. It can help in any type of way or anything you want to know about. You can follow me on Twitter, Dr._Darsh. And then I do have a podcast out called Optimize Your Life. It's on Apple, Spotify. And then I'm probably going to have another podcast out soon with a good friend of mine, kind of talking about alternative medicine and integrative functional medicine. So be on the lookout for that. Other than that, just feel free to reach out. I'd be more than happy to connect.
Very cool. Very cool. Thank you very, very much. And again, everybody, that's at Dr. spelled out .Darsh. And that's Dr. Darsh's Instagram. And as always, I welcome your comments, feedback, suggestions. They're always welcome. Please feel, like Dr. Darsh said, please feel free to reach out to him. Feel free to reach out to me. Check out all previous and future episodes of The Art of Mindful Medicine on YouTube. You can also check out these things on my website, www.mindful.doctor. And of course, we are on Instagram Live. And the dates that I'm doing this are changing a little bit because as I'm working with people's schedules. But just look out for those announcements as to when the episodes are going to be. It's generally going to be on either a Saturday or a Thursday. And as always, I end with a quote. So this is from Wallace Stevens, and he says, "Human nature is like water. It takes the shape of its container."
I like that.
So, yes, me too. And again, everybody, Dr. Darsh, thank you so much. I really appreciate the time and energy coming on here. And everybody, I appreciate you taking some of your Saturday to sit with us and watch this. And if you're not watching it live, I appreciate you taking the time to watch it in general. So again, thank you. And as always, stay awesome, stay mindful, and have an awesome day, everybody. Awesome. All right, Darsh, have a good one.
Yep. Thanks, Seth. I feel woke, man. Thank you.
Have a good one, bro.
Yeah, you too, man.
Thanks.